Welcome to the Ministry of Health's update on the national COVID-19 response for Wednesday, 1st June 2022. We also welcome our presenters for this morning's conference, the Honorable Terence Dialsingh, Minister of Health, Dr. Rushan Parasram, Chief Medical Officer, Ministry of Health, and Dr. Joanne Paul, Senior Pediatric Emergency Medicine Specialist of the NCRHA. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's conference. So without further ado, I invite Dr. Parasram to present the latest clinical update.
Hi, good morning. Thank you, Mr. Alexander. Good morning to the Honorable Minister and to Dr. Paul, members of the media and members of the listening public. So we begin with the update for 31st of May 2022, update number 1106. The population vaccination status fully vaccinated 50.9%. Honorable Minister will go into further details as it relates to the vaccination status. New positive cases over the last 24 hours reported, 149. Deaths reported during that period, 1, and condolences to the families of that person. Total hospitalized patients, 184. Total active positive cases, 9,207. Again, the vaccination status remains, in terms of hospitalizations, the majority of those, 81.2%, would have been, haven't received a vaccine as yet. And total deaths by vaccination status, again, the lion's share of those people that would have passed away have been unvaccinated, accounting for about 93%. In terms of a further breakdown as it relates to the hospital numbers, breaking down the 184, we have at the Couva Hospital and Multi-Training Facility 40 persons at this time, 4 in ICU, 6 in the high dependency unit, 41 persons in Cora, Augustus Long, 41 persons as well, in the St. Anne's Hospital 12, Arima General Hospital 13, 7 persons in the Point Fortin Area Hospital, in the St. James Medical Complex 17, Scarborough Regional Hospital at Fort King George 13, and there's no one in the Scarborough General Hospital at Signal Hill. The step-down facilities remain empty at this point in time. Thank you, Mr. Alexander, for the few minutes this morning.
And thank you, Chairman. We are always happy to have Dr. Paul with us, and this morning she's here to address some of the key questions that we have on the vaccination of children 5 to 11 years old. Dr. Paul.
Thank you very much. Honorable Minister, Chief Medical Officer, Al Alexander, members of the media. Yes, I am. Honorable Minister, thank you very much. Chief Medical Officer, Al Alexander, members of the media, ladies and gentlemen, thank you for inviting me again. Can we start the slide presentation? So I'll just be going through the few issues with regards to the vaccination for 5 to 11 and really answering your queries we've had so far. The first thing, as you see in here, is that we had the standard dose was given to the 12 to 17-year-olds, and this dose for the 5 to 11-year-old, that's a quarter, one third the dose. It's a smaller dose, much smaller, 1/3 the dose so far. Next slide, please. All right. And so a lot of people have been asking me a few of these questions. So the common question is still, was there enough research done with regards to vaccinations for the 5 to 11-year-olds? So just to reiterate, when research is done in terms of medicine generally, they usually do it on adults first, and then you extrapolate to children, because nobody really wants to do a lot of research on children. You try to do as least research as possible. So the research was done on the adults, and then we had the 12 to 17 years old, and for that, I think we had about 2,300 children done. And for this one, for the 5 to 11, the cohort that the research was done on was about 2,000. But interestingly enough, as Professor Monta has said before, because where we usually get the vaccines a bit more delayed after the bigger countries, what happens is that they usually have it where they start in those countries. So for instance, in USA, before we even started here, they had about 10 million doses given to that 5 to 11 age group. So therefore, a lot of the countries afterwards, including us, we have looked at their their trials. So it's having an increased trial, and we're seeing what effects they have had. And so far, all the data has come out of that. So we've had the smaller subsets, but essentially we have had 10 million and more done in USA and other countries. Okay, next slide, please. So if we're looking at this, which other countries, I've often been asked, which other countries are also given the vaccine? So in fact, it's most countries for the 5 to 11 age group. We have, in terms of compartmentalization, we have USA and Canada for sure. Most of Europe, excluding Sweden. In terms of UK, England is just about to. England started off by giving the vulnerable groups first, but now they're giving everybody, and they're moving on to their 5 to 11. Scotland and Ireland are way ahead of them. We have also most in the Middle East, and of course, South Africa, not yet. And we have China, Singapore, Australia, New Zealand. New Zealand started in January. And of course, in terms of South America and Cuba. In terms of organizations who have been saying that they approve, reinforce, recommend, we have WHO, as we know, CDC, and the European Medicines Agency. In terms of pediatric associations, the American Association, USA, and of course our own pediatric association, Pediatric Society in Trinidad and Tobago, they have also recommended the first vaccinations for 12 to 17 and now also recommended vaccines given in that 5 to 11-year-old gap. So therefore we're saying that all of these societies, a group of pediatricians in Trinidad and Tobago, are saying we recommend this highly. So we have countries, we have organizations, and we have all the pediatric societies. Next slide, please. So is the COVID vaccine less effective against the Omicron variant? It is. What we've found is that in comparison to Delta and the previous ones, the vaccine is about 5 to 10% less effective in terms of hospitalizations especially. But that's really for severe to moderate cases. What they found is it's still as effective for severe cases, but a little bit less for moderate cases, and a lot more of the infections have been milder. So we have it less effective, slightly less effective, because of the Omicron variant. Next slide, please. And of course, the question again, I'm often asked, are there any major side effects with the pediatric smaller dose vaccines? So we have had, as we know, we've discussed this many times, between the 12 to 17 age group, there was a small risk of myocarditis, which they found. Now, myocarditis, which we mentioned before, is where the muscle and the lining of the heart is a bit inflamed. And so in a few of those cases, they found that an effect of the vaccine, the COVID vaccine, in that age group, especially the age group above 16 years old. So although it was 12 to 17, it was really the older ones, especially males, for the second dose. There was a small risk of myocarditis, which they found it was self-limiting, very mild, and there were no adverse events, further adverse events in terms of deaths from this. So what they've found so far with this smaller dose is almost zero cases of myocarditis in this age group. So 5 to 11, zero myocarditis cases. I think the US have found about 1 or 2. The rest of the world, nothing so far in most of the studies. And in fact, they have found that they have been self-limiting, short-lived. It's been maybe 1 or 2 days, very mild, and no deaths whatsoever. And so not just in the US with 10 million, but the other countries have found none so far, no myocarditis. But I must reiterate though, I don't want to, it's all relative. So we know that COVID infection itself causes myocarditis maybe about 10 to 20 times more than the vaccine. But again, makes it more relative. The Coxsackie virus, the influenza virus, the other viruses in children, even the one that causes hand, foot, and mouth syndrome, and also the influenza, they cause more myocarditis than the COVID vaccine in the smaller age group. So the reality is that all viruses can have a small risk of myocarditis, and this vaccine for 5 to 11 is even less of a risk. And that's why they say now The risk is so negligible that for most countries it's zero. There's no risk of myocarditis, and it's less than even a normal or flu virus or gastroenteritis virus or hand, foot, and mouth virus. It's much lower. Next slide, please. So, can my child get COVID even after vaccination? I think the minister and CMO have mentioned this a good few times in all their press conferences. Yes, for sure. The COVID vaccine does not mean that you would not or cannot get COVID infection. But if you look at my reduced, so we have it where it's reduced chance of infection, it's reduced transmission, it's reduced chance of MIS-C and long COVID, and significantly, especially with Omicron, because we found Omicron has a higher reinfection rate. In fact, every 1 or 2 months so far, with some individuals, there has been a reinfection. It reduces significantly reinfection. So we have less transmission, less MIS-C, less long COVID, and reduced reinfection. Next slide. So do children 5 to 11 years have mild infections with COVID? For sure, especially with Omicron. So what we've found so far is that the hospitalizations has reduced. We've mostly seen the incidental, especially the 5 to 11 age group. It's been much less with that age group. The ones who have had in hospital who have been moderately ill with Omicron or severely ill have been less than 1 year or above 11 years old. Usually it's where they have comorbidities, chronic illnesses. So we have a combination where Omicron is milder, and we have had mostly mild or asymptomatic infection with Omicron. Next slide. So in combination now, we're saying if the Omicron has been milder, why should my child, not vulnerable, have the vaccination? So we know that the vaccine so far has almost negligibly no adverse events aside from mild. The normal vaccine, it might have some fever, some mild irritation on the side, etc. So we know that for a fact. And then we're saying, why should you, if your child is not vulnerable, why should you get the vaccine? Well, it's a combination. So as I mentioned before, the previous slide said the same thing: reduced chance of COVID infection, reduced transmission, reduced chance of MIS-C and long COVID, reduced reinfection. But in addition to this, we have it where it's reduced spread to not just the vulnerable adults in the home, but the elderly and also the vulnerable children. So in every class, in every school, we have it where we have some children there who are vulnerable, who do have chronic illnesses, so it reduces spread to them. So by doing this, we also protect that other age group. Now, we know as a fact, once we've had school open, we know we've been having lots of parents who have been having infection from when their child comes home from school. There has been the pickup there where there has been some spread in the homes. And with this COVID vaccine, we can reduce that spread in your own home. The other thing is that we have reduced spread in schools. So I'm looking at reduced downtime where you have to have children go home because we're in quarantine, which will have reduced transmission, reduced spread. Then we can have more schooling, less downtime, and significantly, aside from school, activities, sporting activities. I think Professor Hutchinson spoke about the fact that although the adults, the elderly, have been having more of a physical effect with COVID, we have found that the adolescents and the children have been having more of a mental health effect with COVID, and they need their schools and they need their activities. So with this, we're having reduced downtime in schools and more schools for your children. But the other point to make is that we have July, August happening soon. So the thing is that if you want to have your child traveling and going to do things, you want to have extra protection for your child before they go anywhere during that July, August sojourn. So I'm saying you have to have it's like an extra barrier. You have it where you protect your child further from anything that's going to happen. Next slide, please. But of course, we have a but also. And we've been going on the NCD trail for, before and also especially now. And the thing is that we know with NCDs, our population has one of the highest in the Americas with regards to obesity and diabetes, and that's the adults. But we know also for our children, we know also obesity and diabetes, sometimes called diabesity, is a main comorbidity that actually affects in terms of your COVID, your chance of having severe COVID or dying from COVID. And of course, with regards to our children, we want to protect them, because if we're saying that we have had a high amount of obesity with our children, we want to make sure in this at-risk population that we protect them extra. Next slide, please. So in the TT Moves launch recently, Professor Tiloxin spoke about the fact that he gave some clear figures. We have 70% of our adolescent population are obese. And these are figures from all the data they have done, all the updated data. We have 60% with high blood pressure, 25% who are diabetic, and 50% of our children are obese. So what we found in terms of the vaccination, a few countries were giving to the vulnerable groups initially in that 5 to 11. But what they've found is that they've moved on now to giving offering to all 5 to 11 age group, especially for at-risk populations. So it's not just about vaccination. It's looking at your population, and with 50% of our children having an issue in terms of obesity, the figures given by Prof, I would say that we have to make sure all our children are protected because we are at-risk population. Next slide. But also, we have to remember that we're in June right now, and the year is still going along. And we've had it move from Gamma, we have had Delta, we now have Omicron, we now have the BA4 and the BA5, which are subsets of the Omicron variant, and we're not sure what's going to happen for the rest of the year. So it's just about having that extra protection, because although we're having Omicron is milder now, we might have with the next variant where your vaccine can stand up to any other variants that's coming through. So you really want to have that extra protection. Next slide, please. So essentially, we have it where it's a smaller dose. There is no myocarditis. What happens is that it's less time off from schools. Protection for the July, August vacation. We have more activities for our children. We have less spread, less transmission in schools, and we have more herd immunity, or at least increased herd immunity in our population, and less risk for our at-risk population in terms of the adults and the elderly. Next slide, please. Essentially also, is being offered to most countries in the world. It's recommended by the Mayo Clinic, Harvard, John Hopkins, all those key centers we talk about. We talked about CDC, we know WHO, all the pediatric associations. So if we're saying that all of these guys are saying their research is recommending this highly, I'm saying to parents that as a member of the Pediatric Society, I'm also, and the team are recommending highly that you go out there and protect your children. Next slide, please. But it's still your choice. So I'm here to give you the information. If you want more information, you can always go to your pediatrician, both private and public, or speak to your nurse or your paramedic or any doctor in your area, etc. But the fact is, that's what my job is, to give you the information, to look at it and see and decide for yourself. But if it was me, next slide please. If it was me and it was my child, I'm telling you right now, I would definitely, for all the various reasons identified, I would definitely go and carry my child to get vaccinated. I want to have a vaccine life jacket. When you put the life jacket on, or the seat belt, when you have it on, it's not that anything would happen. You just want to make sure if anything happens, you have extra protection for your 5 to 11-year-old. Thank you very much, ladies and gentlemen. Thank you for being here.
And thank you very much, Dr. Paul, for another very informative presentation. We close off this morning's presentations with the Honorable Terence Dial Singh, who will provide the latest vaccination figures and updates on the current initiatives regarding the national COVID-19 vaccination campaign. Minister.
Thank you very much, Al. Good morning to the Chief Medical Officer. Good morning to Dr. Paul and thank you for your very robust and complete explanation of the need for parents of those 5 to 11 to make use of the COVID vaccines which are available to their young children to help protect them. I think the takeaway message is that make an informed choice. Parents have been given all the information, and make the informed choice to get your children vaccinated. So what are the vaccination figures as of last night? First dose, 692,512, which is about 49.5% of the population. Those who have completed their vaccination regime, 712,605, which is 50.9% of the population. The total number of persons who have been boosted, that will be from ages 12 go up, because we started with the 12 to 18 a few weeks ago, 158,902. The total number of doses for the 5 to 11, 5 to 11, which we started last week Wednesday, 862. So that is where we are with the vaccination numbers. Let me just give you briefly the number of cases in schools for the period. And let me just get the period here. We just got the figures. For the latest period, 172 positive cases, and that is for the period 23rd to 29th May, 172 positive cases. Number of schools with positive cases, 105. And number of schools tested, 124. So I'll just repeat that because I know you take notes. For the period 23rd to 29th May, 172 cases. Number of schools with positive cases, 105. And number of schools tested, 124. So Al, that's my very short summary this morning, and I think we are ready for questions and answers.
Thank you very much, Minister. We are asking our media representatives to please state your name and the name of your media house before presenting your questions. We will take 2 questions in the first instant, and of course, if we do have time, we will take additional questions. For this morning, we will start off with azpnews.com.
Hi, good morning. Prabhi Hari, AZP News. My first question may be for Dr. Paul. Dr. Paul, I know the minister spoke about this last week, but there's still the concern of the pediatric vaccines that on the label shows that they expired in April, but I know it has been extended until October. Can you just, explain to some parents who may be skeptical about, giving a child based on the expiry date? One, and my second question, maybe to the minister or the CMO, when AZP News, we have had some reports that when certain people go to get their vaccines close to 3 o'clock, because these centers close at 3, they are being told that if the nurses have to open a new vial, maybe because a vial contains 6, 5 may waste, and therefore people are being turned away at that point. I don't know if you could shed some light on that. Thank you.
Thank you very much.
Sure.
CMO will take those questions.
So yeah, as Minister would have said last week, the expiry date on the vaccine vial itself will say April 2022. We have received a document from Pfizer International indicating that the expiry for certain types of vaccines, including the one that we had in Trinidad, has been extended, and this is normal practice for the COVID-19 vaccines that have been happening since their availability, and we would have had a number of vaccines in Trinidad that had extensions of their shelf life based on the manufacturer's reclassification. So this is just one of them. So it has gone from April 2022, which is on the bottle, and they have given it a 6-month extension of shelf life, which takes us to October 2022. By way of your second question, yes, we noted that in some instances that is occurring, and I have spoken to the manager of EPI, even in the past when we would have had it occurring with other types of vaccines, to create a system where they can pull in other people, even from the district or utilizing their listings that they have, so that doesn't happen. But again, it's something that we're treating with through the RHAs and the nurse manager at the Ministry of Health to ensure that everyone who turns up gets their vaccine on time.
Thank you very much, CMO, and thank you for your question prior. We go to Newsday for your two questions. Good morning.
Good morning to the panel. This is Paula Lindo from the Newsday. So my first two questions are for the Minister. The first one is there or have there been any discussions on a policy for the full removal of mask wearing after July 31st when the current ordinance comes to an end? This is in light of the many events that are being planned, especially band launches, Carnival in Tobago, which may have potential street parades. Does the ministry intend to make a recommendation to the Prime Minister? And the second question is, does the ministry have a response to the recent letter by doctors calling for a rethink of pediatric COVID-19 vaccines for low-risk children? And what does the ministry think they mean by low risk? Thank you.
Thank you. So, on the issue of mask wearing, the ministry continues, as we always do, to monitor our local situation. We monitor what is happening regionally, internationally, before making recommendations to the Honorable Prime Minister. And when we have to make that recommendation, the Honorable Prime Minister will be briefed, and as he always does, either he himself or he will delegate it to me to make the announcement. So that is where we are with mask wearing. On the second issue of the vaccines, I think Dr. Paul went into all the details, so maybe you can repeat it in case Ms. Lindu did not get the information. Thank you.
Sure. Thank you, Minister. What's happening with, I did see the information in the media, the letter that was sent out, and with regards to all due respect to my colleagues, and the thing about information is that most people have a right to opinions, and as long as they have the information out there. The thing about the low risk, they're looking at those who are not vulnerable, so those are the ones who have no chronic diseases, who are not obese, no comorbidities, etc., and those are your children. What they've found is that most countries have two approaches. So they had that approach given only the vulnerable ones or the high risk, and then the other approach was giving everyone. What they found is that that first approach was very limited. So most have changed that approach. So although they had two choices, they found the second approach the best way in terms of having it for all the children, no matter if it's high risk or low risk. Because what happens is that if all of them are protected, you have less transmission to everyone. So by protecting the low risk, you actually protecting the higher risk also. So they found that entire process was the best way to go. And in addition, as I mentioned before, because obesity has now been classified as a comorbidity, we found that in Trinidad we have a high degree of obesity with regards to our children. So you really want it's not just about those who are diabetic or those who are cardiac or whatever. It's also those who are obese. So the best way to go now is to definitely give it to everyone. No risk, low risk, high risk, medium risk, kind of risk, any kind of risk. You have to make sure everybody gets it, so we protect that first layer, the vulnerable ones, the vulnerable adults, and the elderly for entire population. Thanks for that question.
Thank you very much, Dr. Paul. TV6, we are ready for your questions.
Hi, good morning to the entire panel. Alicia Boucher from TV6 News here. My first question is for the Minister, and I just want to follow up on Paula's question about the mask wearing. Minister or CMO, is there any evidence at this point in time that would point to the removal of mask wearing based on what we're seeing internationally in terms of, spikes in other countries and so on. So I just want to find out, where we are in terms of, analyzing that data and in terms of whether we keep that in place or whether we remove it. So I don't know if you could speak to that. And my second question, Tutor would have complained about 2 weeks ago about parents who are failing to test their children who are exhibiting flu-like symptoms, and what they're doing is they're keeping them away from school for a few days and then reintroducing them into the school system, not knowing whether or not that child may have had COVID-19. And I just wanted to ask, do you have any words of caution or perhaps advice as it pertains to this practice? Thank you so much.
Yep. So as you know, as Minister would have indicated, we normally make recommendations to the Honourable Prime Minister as it relates to various public health interventions. And for masking, we did recommend that it remain in place at this point in time. Omicron is a highly transmissible variant. It is the most transmissible variant that we have seen so far of COVID-19. There's significant evidence supporting both respiratory droplet infection as well as aerosolization, which means smaller particles be able to go a greater distance in the air and linger in the air for some period of time, so that the risk of infection, even in closed spaces or in close contact, is greater with Omicron than it would have been with the previous variants. And at least from an evidential scientific perspective, going back to basic principles, it is important that masking be maintained to decrease the likelihood of spread at the population level at this point in time. We have seen other countries in the world remove their mask mandate, and some of them have reintroduced them a few weeks or months later based on the increase in cases. All around the world, we have seen reintroduction of masking mandates to deal with surges. So we have maintained ours. So we are seeing, in terms of our trajectory, as expected, there was an increase in the early part of May, late part of April, because we had changed our regulation on April 4th, where we removed a lot of the restrictions that were in place. Of course, as Dr. Paul would have indicated, schools began for the 5 to 11s as well, which increased the amount of movement in the population generally. And we saw that upsurge occurring. Now we're seeing a little bit of a plateau with a slight bit of downward trajectory, which is a very good sign. And to remove the masking mandate at this point will be contrary to the evidence that we have before us. So it continues for now, as Minister would have said, until July, and then we review during that period based on the evidence that comes forward.
Yeah, let me just come in here again. As the Minister of Health, who has to guide the health response and make the necessary recommendations to the Honorable Prime Minister, our view and my view at the Ministry is that at this point in time, at this stage of the pandemic, where people want to put this virus in the rearview mirror, and for understandable reasons, people are tired, people are fed up, and so on. The last thing you want is a Minister of Health recommending to do something because of public pressure and to be popular, or because a question is asked in a press conference. When you do that and you give in to public pressure, and then you have to reintroduce the mandate as other countries have had to do, you find that the public loses all faith in the government. They lose all faith in the measures because they don't like the yo-yoing of positions. Today no mask, tomorrow we ask you to put back your mask mandate. So I understand where you guys are coming from this morning, reflecting the public's opinion. I talk to the public every single day, and I get this question every single day. And at this stage of the pandemic, for the public to really have faith in our response, the last thing you want to do is to make a popular decision because of public pressure. And then 3 weeks later, you have to reverse that. The public will lose all faith in the public health measures, especially at this stage of the pandemic. You may have been able to get away with that 2 years ago or a year and a half ago, but we were still in the throes of the very acute phase. But I think the way we have gone about it, being cautious but brave, last week, today is another brave step in that we have more or less done away with TT Pass. Let's see what happens. And let's see what the evidence shows for the next 2 months until the end of July. We will continue to monitor. I give you that assurance. And as soon as we feel comfortable that we could take off masks in certain settings, we will make those recommendations to the Honorable Prime Minister. And as usual, he will either announce it, or if he feels, he can delegate it to me, but I will not be making any announcements without the authority of the Honorable Prime Minister. Thank you very much. Sorry? On the issue of testing for children? No, the CMO and answer that?
No, I didn't. So basically, your question doesn't only apply to children. I think your question applies across the board. So someone gets a flu-like illness, you're saying that they're not testing themselves, they don't know what they have, waiting till symptoms subside, and then they go back out to schools. Generally speaking, our positivity rate in the country hovers around 40% still, which means that the likelihood, especially if you're exposed to someone that would have had COVID before or suspected COVID, if you have a flu-like symptoms, you have almost a 1 in 2 chance of it being COVID. Our policies in terms of isolation refer to 10 days if you have no symptoms. And of course, in these instances, patients have symptoms, and 13 days, meaning that your last 3 days of the symptoms are free of fever, cough, and any other respiratory symptoms. So 10 and 13 is recommended based on the evidence that exists for Omicron. So what the evidence suggests is that after a period of 10 days, if you're asymptomatic, that you don't have viral particles being shed, so that you can't be infectious in 90 to 95% of the cases. When you go to 13 days, with the last 3 days being free of acute symptoms, again, that same sort of figure holds. 90 to 95% of cases, you can't infect others. So even if you don't want to be tested at this point in time, you should assume that it is COVID-19 until proven otherwise, and certainly stay away for a little bit longer than 2 days or 3 days before you enter your environment, whether it be schools or your workplace, to ensure the safety of everyone around you.
Thank you, Minister. Thank you, CMO, for that clarification. We go to Guardian Media Limited. We're ready for you.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Minister, I just want to find out a little bit more details about the figure that you gave us for the pediatric vaccines that were administered so far. What is the overall viable 5 to 11 population? Is it around 90-ish thousand? How many children are viable for that vaccine? Do we know? And my second question is to build on 2 things that we've been speaking about so far, the quarantine and isolation period, as well as the mask mandate. So, Minister, I noticed in your last statement there, you did a hint towards removal of masks in certain settings, and that is what I wanted to follow up on. Do you see that whenever that time comes for the removal of the mask mandate or the loosening of it to any extent, that it may not be an entire removal, but maybe in outdoor settings where the evidence is showing that there's very little risk of transmission of the virus? And when we are talking about the quarantine and isolation period, are there any plans to further reduce that time period in line with what some other countries are doing globally? Thank you.
Okay, so let me be clear. Correct me if I'm wrong, Al. I don't think I spoke about the removal of masking in any setting. What I did say, and let me repeat it, the removal of the mask mandate is something we will discuss with the Honorable Prime Minister, who will make the announcement, or if he feels he can authorize me to make it. I don't think I spoke about the removal of masking in any setting. Correct me if I'm wrong. I'm not sure, but I don't think I did that. So hopefully we could put this issue of removal of mask mandate to rest. You asked a very good question about the number of children eligible to be vaccinated. 511 is over 100,000. That is the data we have from the Central Statistical Office. And the issue of decreasing the quarantine period, again, Richard, we constantly review these things, and when we have a position, we will recommend it to the Honorable Prime Minister on anything that is a major deviation from current policy, and either the Honorable Prime Minister makes the announcement or he will assign myself to make that announcement to do with changes to the quarantine period or masking or any other major policy shift. Okay? Thank you very much.
I want to thank Richard for your 3 follow-up questions. We want to remind you, 1 question, and once it's a follow-up question. Newsday, I see you do have a single follow-up question. We are ready for you.
Hi, good day. So my first follow-up question is, could you give us an update on the decommissioning of the Arima Hospital as a COVID-19 facility? Because we understand that patients who need radiology services and other services are being sent to Mount Hope. So could you tell us when that facility will be decommissioned? Thank you.
Thank you. So this Sunday, June the 5th, will be the official handover of the Arima Hospital to the Arima community, so it can be used as both a primary and secondary facility. So that takes place on Sunday, June the 5th, this Sunday. Okay, thank you.
Certainly good news. We go to Guardian Media Limited. Mr. Khan?
All right, thank you very much, Al. Minister, now today is the day that we remove the travel pass requirement, and based on my interpretation of what I'm seeing, I think there is a way that somebody, or I don't know if I'm interpreting it correctly, but there is a facility for someone who does not present a test to come and quarantine. So is there any concern that people would basically know they're positive and don't submit a test to come into Trinidad and have to quarantine?
You take that.
Thank you for your question. CMO?
Right, so I have been in communication with the Airports Authority of Trinidad and Tobago. I don't know if you noted that they put out a release indicating that the onus would be on the airlines to do the front-end checks of persons presenting their PCR or antigen prior to boarding. So if you don't have a PCR or antigen negative within 48 hours prior to entry, you should not be allowed to board the aircraft. It is an entry requirement of Trinidad and Tobago. The part that you see in our press release that indicates if you don't have a PCR or antigen upon arrival at Trinidad, when we do our checks, meaning Port Health does checks upon arrival, then there's a mechanism where we put you into state supervised quarantine at your cost, where you would have to do the test at that point, and if you get a negative, you present it back to Port Health as a condition of release. So it is not a way to not have a test presented. It is in the instances where persons board the plane, are allowed to board the plane without having a test. And as I said, because of the communication we had with Airports Authority and the airlines, we hope that the airlines comply and there isn't an issue arising in that regard. But if one does arise, that is the mechanism we have in place in terms of the quarantine, utilization of the Quarantine Act to have persons quarantined and provide the tests upon arrival. So it is not a either or. You have to present as an entry requirement PCR or antigen. If you don't, and you slip through the cracks, if you want to call it, that sort of situation arises, then you enter state supervised quarantine at your cost and provide a test when you arrive.
Thank you very much, CMO. TV6, we are ready for your follow-up question.
Okay, thank you so much. My question this time is for Dr. Joanne Paul. Dr. Paul, you would have spoken about a reduced risk of transmission in relation to the vaccination, right, for the 5 to 11. We know that vaccines have been proven to reduce certain risks such as hospitalization and so on, but based on evidence, there is conflicting data in terms of whether or not vaccines actually reduce the risk of transmission. coming from against the backdrop of, like, for instance, countries with high vaccination rates where you've had high levels of breakthrough infections and surges. And so I wanted to ask, is it accurate to say that these vaccines would reduce the risk of transmission? Can you address that? Thank you.
Sure. In reviewing the data, it's been shown that the vaccine itself reduces the viral load, the amount of viral particles in the person's system, and thus by doing that, it does reduce the amount of transmission. So what happens is that if I have a high viral load, when I cough or sneeze or shout, I will then say if I have 100 particles, I'll send 100 particles out there, and therefore my risk of sending more to most people will be increased. If I have my vaccine and I have a viral load, say just a number 25, just a comparison, I now send 25 particles, therefore I'm able to transmit less, and they're weaker, they go in a shorter period, they don't go as long as possible. So they go shorter period, not as far, not as many, and that's been proven. I think Professor Monta has come on. In the beginning, I also came on and went through that mechanism, and the data does confirm, and it's been consistent. The breakthrough infections, though, remember, it's not about the fact that you won't get breakthrough infection. You will get reinfection, especially with Omicron. So what I've seen is that when you've had the new variants, you are having surges as there's reinfection. So every month or 2 or 3. But the actual vaccine also reduces reinfection. So it's confirmed with regards to microbiology, virology, and infectious disease. You do have reduced transmission with regards to reduced viral load, and it's been confirmed that it does reduce reinfection. So it's 2 different things. Transmission and reinfection are 2 separate things. But thanks for that question. Mm-hmm.
Thanks for that clarification, Dr. Paul. And we go to Newsday for a follow-up question. Ms. Lindo, we are ready.
Good day again, sorry. My next question is, Dr. Paul just mentioned reinfections. I want to find out, are we collecting data on how many of our cases are reinfections since we relaxed the protocols? And then also, do we know how many deaths have occurred in people who were reinfected? Thank you.
So I think the short answer is no. It's extremely difficult to collect the reinfection data. We are working in terms of the deaths to look at persons that would have had reinfection. So that is being collated through the EPI unit, and we can provide that at a later date. But in terms of general infection, is because of the large number of cases occurring through the lab information system, I have asked them to try to look at those that have repeat positives, for example, to see if we can get some of that data out of the lab. So that is something we're working on separately. But certainly in terms of the deaths, we can get the data in a week or 2 when Dr. Hines collates everything together.
Thank you, CMO. We return to Guardian Media for another question.
Well, thank you all. I just want to follow up on something that was mentioned last week. I know last week when we were speaking a bit about monkeypox, there was some mention that the Ministry of Health was in some discussions with CARFA and UE when it comes to building testing capacity as well as sequencing capacity. Can we have an update on that?
Yeah, sure. Thanks. So I spoke to both CARFA and UE this morning. They are still pursuing the genomic sequencing capacity. As far as testing capacity, that is under the remit of CARFA. They have informed that they are very close to building out their testing capacity for the CARICOM region, and in the interim, they have joined up with the CDC. So in case they have any samples from the CARICOM region, they will send their samples onward to CDC for testing. So that is where we are at present. So CARFA is working on the testing capacity. So they are trying to build out their local capacity testing for CARICOM. But as I said, in the interim, they already have joined up with CDC. So if they have samples from the region, they will send it onwards to CDC for testing.
Thank you very much, Minister. TV6, we are ready for your question.
Thank you again. Quick question, either for Dr. Paul or for the CMO. Do we have an update on the cases of hand, foot, and mouth disease in children?
Is there a particular epidemic or outbreak of these cases you're speaking about? Or in general, the number of cases per year?
In general. No, do we have any cases at present in terms of happening right now?
So generally, hand, foot, and mouth disease is something that is fairly, I would say, endemic to the region, to the CARICOM region. We would have outbreaks from time to time, small clusters of outbreaks occurring mainly in school settings. We haven't had one, as far as I am aware, at least at a national scale, for quite some time. But generally speaking, you would get small outbreaks in schools, in those vulnerable populations from time to time. It is a self-limiting disease to most instances. And again, no major outbreaks in the last recent. Yeah, they would have cases, yes. So Dr. Paul will give some details as it relates to the cases that she would have noted coming through the emergency departments in the recent past. As I said, it is an endemic disease, so you will get cases from time to time.
Thanks for that, CMO. I think after the children were, we were home for a bit after online schooling, when they were allowed to go back to school, there was a few cases. So we had some increased cases in terms of gastroenteritis, some wheezing, and also some hand, foot, and mouth. And also I think mentioned chickenpox. And as CMO was saying, it wasn't really an outbreak per se. We definitely saw increase in the amounts both in private at private pediatricians and also the emergency departments in the in North and South. It's been reduced now, so I think that there has been a bit with children now in school for a bit. That initial few cases did reduce, so it's not really an outbreak per se, but we had a little blip of cases as most of the pediatric persons found. So I try to feedback to get their information, and that's the only surge they've been seeing so far. Thank you.
Thank you very much, Dr. Paul. Newsday, we are ready for a follow-up question from you.
Right. My next follow-up question is, a few weeks ago, the Minister of Digital Transformation would have said that the digital vaccine cards are a moot point. So I wanted to find out what the ministry thinks about that. Thank you.
Thank you. So the digital vaccine cards globally are becoming less and less important as the world is easing up all travel restrictions. I didn't hear the comment, but I do agree that as time passes, the issue of a digital vaccine card is becoming less and less of an issue and less important, especially now as we are doing away with the TT travel pass, and most countries are trying to get back to a state of normalcy. I think the takeaway lesson is that as most countries come to this stage of the end of this acute phase, bearing in mind that something could happen in the future, it is not something that is totally off the burner, but we will continue to work behind the scenes on it. Thank you.
Thank you very much, Minister. azpnews.com.
Thank you
again. Question from you. Yes.
I know last week the CMO spoke about the monitoring of animals, in terms of the monkeypox. But I know that there has been an increase in rabies in South especially. I don't know if there is any update on that, is there still an outbreak of rabies in South, and what is the situation there? Thanks.
Yeah, so no human cases of rabies, first of all. A couple of months ago, there was an increased number of cases in the cattle, especially in the Southern District, which was reported by Agriculture to the Vet Public Health Unit of the Ministry, and we would have noted that surge occurring then. I haven't received any increased cases beyond that was reported previously. So of course, we will let you all know if there's any increase, either through the Vet Public Health Unit of the Ministry or the Ministry of Agriculture.
Thank you very much, CMO. And we close off this morning's program with the last question from Guardian Media Limited.
Right, thank you, Al. Minister, I just want to follow up on Paula's question there about the digital vaccination cards. But while it is becoming less important now, at one point it would have been, I would say, very important to have something like that with the initiatives that we had in place, and probably for any other future pandemics, outbreaks, anything like that. So how do you feel as Minister of Health that we're now almost 1 year since we started mass vaccination and we could not get that off the ground?
Thank you. So as both myself and Minister Bacchus had explained, there was a serious data breach globally in December of this year, December of 2021. That major data breach taught us some lessons, and my previous comment was that it is something that I am still looking at, because we don't know where this virus is going to go. So right now, the need for a digital vaccination card is one that is declining in importance, but we have to be aware that COVID is not done with us. We might feel we are done with it, but COVID is not done with us. We will continue to look at the need for a digital vaccination card as we move forward. But the main reason why we could not have done it was because of this major data breach that occurred in December of 2021. Yeah? Thank you very much, Richard.
Thank you, Minister. As we close, we want to thank the media for their engaging questions and you, the public, for tuning in. We ask that you please continue to protect yourself and your loved ones. And as restrictions are being lifted, we want to remind you to remember to practice those 3 W's. Continue to follow the Ministry of Health on social media for accurate and up-to-date information. And please, stay safe. Goodbye for now.
I could get £2, please. Dre, you want any?
Yeah, sure. What's that?
Oh, that's rambutan. It here, yeah?
Girl, you doing?
You afraid of a fruit, Dre?
Needles. That thing look like a whole ball of needles.
So I guess you won't be taking the vaccine then.
What? And leave a big hole in my arm? Correct is right.